Welcome to the Bridget tutorial on dental charting. When a patient first visits us, the first thing we'd want to do is record their base charting. We can easily do that by switching to base on the right hand side. We have a list of all the treatments that our practice has set up in the right hand side of the screen. But in order to narrow down that list, I'm just going to choose my base categories, and we can make this list whatever we like, but in this instance I've just chosen a few. So if we wanted to record that the patient had missing teeth, for example, in certain areas, maybe they've got some previous fillings, and it literally is as simple as choosing the treatment on the right and then clicking on the chart in order to record these treatments. Once we've finished with the base charting, we would normally just switch to all. And in order to start recording future treatments for this patient, we have to add a course of treatment. So let's do that on the right hand side. If we add a course, that will always add at least one appointment to our course. Now obviously the course can be made up of as many appointments as you like, but you must always have at least one appointment in that course of treatment. So if I switch back to my full view of treatments, again, now we can just choose whatever treatments we would like to do. So I'm going to record an examination. Because these are yet planned treatments, they're going in blue into our chart. Let's do another appointment. So I'm going to click on Add Appointment, which will add another appointment to our course. So I select Add Appointment, and in appointment 2, maybe I will do a denture. So let's select full upper acrylic denture, and I'm just going to select the start tooth and then the end tooth. And now it applies to all the teeth, so I'm just going to press OK. And notice what this has done is it has not only added our denture impressions, but because in our database we've set up that this treatment takes multiple stages, it's automatically created those stages for us on the left hand side. So we can see appointment 2, denture impressions has gone into there. It's automatically created us an appointment 3 for a try-in, and automatically created us an appointment 4 for a fit. And these can be set so that there has to be a minimum time interval between those stages as well. So it can be fully configured as to how your practice would like to work. Once we've completed a particular treatment, we can just tick it to say that we have finished that treatment, and then when we save and close, that can then be invoiced on reception, or indeed we can invoice it in the surgery, but generally that will be passed down to reception for them to handle. If we want to make a clinical note, so for example if we come to our denture impressions here, let's say we've completed that and we would like to add a note to our impressions, then we select the treatment that we want to attach the note to, and we choose Add Note down the bottom. And then we can either free text our clinical note, or we can set up a whole load of clinical note templates that are either personal to us as a particular provider, or that we can use practice-wide. In this instance I've set up some already. So let's just choose our denture clinical note. Again, we can select however many we want to, but in this case I'm just going to select my denture clinical note. That then pulls in our template, and if we wish to, we can just add any additional information that we want to go into our clinical note at any time. When I OK that, that clinical note will now be attached to our treatment. Now that is in red at the moment, which means it's currently unlocked, and a clinical note will remain unlocked until the end of the day. So any time during the day you can re-edit that clinical note, make whatever changes you need to, and then we can OK that, and that will change it. However, at midnight of the same day, that note will become locked, it will turn black, and then there's no way we can adjust that note. However, we can, if we need to, void the note. So that note will stay there, but it will just be in red with a big red line through it, but it just shows for legal reasons that that clinical note was made. And there's many more things we can talk about when it comes to dental charting. For example, let's just delete that course of treatment. And let's say the patient would like to have different treatment options for their course. Now, if that's the case, we can just add a course of treatment as we would normally do, but instead of actually charting directly onto the chart here, we can simply add some treatment options. Now, this performs in exactly the same way as dental charting, but instead of a course of treatment, we have options on the left-hand side. So let's say for option 1, we would like to add a bridge. So as we can see, this has created our bridge. Again, it's gone on multiple stages with a bridge prep, a try-in and a fit. So that would be one option we could offer to the patient. If we wanted to offer multiple other options, then we simply select Add Option again. It says, would you like to copy the previous option for this course of treatment? Well, in this case, we'll say no. So we're going to give them a completely different option. Let's say we're going to do them a couple of implants, for example. Again, this has gone in with multiple stages. And we can add as many options as we like. And once we've finished that, we can print off those treatment options. So these will all be listed very nicely on a printed page. The patient can then take this away and choose which option they would like to go for. So if I come back to our chart, we can see there's still nothing in the dental charting, but let's imagine the patient has returned and they've selected that they would like to have the bridge option. So we just simply click on the course, go back into the treatment options, we select the option that they've chosen, which is our bridge, and then we convert the option to a plan. And that has now taken our option and immediately put it into our actual course of treatment for us to start treating the patient. So that's for private dentistry. Let's just very briefly cover some NHS work. Again, it's exactly the same. We need to add a course of treatment. If I switch to NHS on the right hand side here, we chart in exactly the same way as we normally do. So let's imagine we've done an examination and then the patient needs to come back maybe to have another filling. So we're going to just chart a filling. Now when we save the patient record, what the program will do, because these are NHS treatments, is it will automatically ask, well, we've already completed a band 1, would we like to add a band 1 charge to this course so far? So we will do that, and then it has automatically created an FP17 in the background, charged the patient that band 1, but it very intelligently tells us that not only has a charge band been raised, but it will not send the claim in the next transmission because there are still NHS treatments outstanding. So let's imagine that the patient comes back and it automatically takes us to our next appointment. So we'll just complete that amalgam filling and then we would save and close again. And it has now decided that because we've completed a band 2, it has automatically created us a band 2 £59.10, and it will send this FP17 in the next transmission because all the treatments have been completed. If I wanted to look at that FP17 at any time, I can just click on the course and then select View Claim Form down the bottom here, and that will show us all the details that it's put into our FP17. And if we wish to make any adjustments to that at the last minute, we can do so on this particular form. So I hope that's just given you a very brief overview of how dental charting is performed within the Bridget software.